With that, I thank all of the presenters, and just out of respect, I want to turn things over to Kasali Simon. Dr. Simon, are you on?
Yes, hi.
Hi, take it away.
So yes, it's too bad these sessions have so much exciting and really, really innovative, things we want to delve into, and then time comes. But we're going to try and continue the same type of approach to the conversation, moving now to the federal policy approaches to address maternal health and maternal morbidity. So I'm Kasali Simon. I'm the Herman Wells Endowed Professor and Associate Vice Provost for Health Sciences at Indiana University. I'm faculty in the O'Neill School of Public and Environmental Affairs. I am pleased to introduce our presenters for this panel. We're switching gears from these really promising state and local interventions we've been hearing about. So it's been a really great privilege to learn. And we're now going to turn our attention to these policies that are being considered and implemented at the federal level, and thinking about how these can contribute to the advancement of maternal health equity. So our first speaker is Jamila Taylor, who is the Director of Healthcare Reform and Senior Fellow at the Century Foundation, where she focuses on their work to build upon the Affordable Care Act. So it's my pleasure to turn things over to Jamila.
Hi, good afternoon, everyone. It's a pleasure to be here. So I'm Jamila Taylor, the Director of Healthcare Reform and Senior Fellow for the Century Foundation. And my presentation today is going to focus on the federal policy landscape for Black maternal health. Next slide. So the Century Foundation is a progressive, independent think tank that conducts research, develops solutions, and drives policy change to make people's lives better. We pursue economic, racial, and gender equity across a number of policy issues, and we were founded over 100 years ago by progressive business leader Edward Filene. Next slide. So for today, I'm really going to focus on a host of issues and hope to do it as concise as possible, because I want to make sure we have time to get to my fellow panelists and then also have time for questions and discussion. I'm going to start off by grounding the conversation with a definition of structural racism. I'll share some examples for how structural racism manifests in care. I'll go over maternal mortality disparities, which, now that I think about it, you all have probably heard several times throughout the workshop. I'll share more about how racism drives maternal health, the reproductive justice framework, which is really a framework that we use to develop solutions, both in terms of policy, programmatic, and across a host of other areas in maternal health. I'll share more about maternal health bills that have been introduced both in the 116th Congress, as well as the current 117th Congress, go through some bills that I think are really central to the conversation, particularly around advancing Black maternal health, and then end with some actions from the Biden-Harris administration, some solutions I'd like to suggest, and then close with some suggested readings. Next slide. So structural racism is defined as a system where public policies, institutional practices, and cultural representations work to reinforce and perpetuate racial inequity. This definition is credited to the Aspen Institute. Next slide. So how does structural racism manifest in care? These are just a handful of examples that I want to share with you today. The first is that we see structural racism in the fact that health provider shortages and lower quality hospitals are concentrated in neighborhoods with majority people of color. We also see racial bias and stereotyping of people of color by healthcare providers. We see differential treatment in the management of pain, as well as the practice in treating those conditions. And this dates back to slavery. I like to talk about this in the context of, these historical foundations that we saw where there was a perception that Blacks had thicker skin or a higher threshold for pain. And we see it again, time and again, in terms of the context of healthcare that Black people receive even today. We also see structural racism manifest in the lack of culturally responsive care and efforts to undermine or sabotage publicly funded programs such as Medicaid, which are disproportionately used to serve people of color. Next slide. Again, I'm sure you all have seen this stat today, as well as yesterday if you've been participating in the workshop. Black women are about 3 times as likely to die of pregnancy-related causes when compared to white women. American Indian and Alaska Native women are about 2 times as likely. And these disparities are even more vast when we look at near misses also on maternal morbidity. Next slide. So research suggests that the cumulative stress of racism and gender oppression undermine the health and well-being of Black women. This is fueled by predominantly white power structures that perpetuate imbalances and a lack of empathy and respect for Black birthing people. This means that our solutions need to be grounded in social justice frameworks that are intentionally designed to address these power imbalances. Next slide. So that brings us to the reproductive justice framework, a framework that was coined by Black women in the mid-1990s at the International Conference on Population and Development. RJ is a human rights-based structured approach that addresses the intersecting systems of oppression that prevent marginalized people, primarily women of color, from achieving complete bodily autonomy and parenting with dignity. Next slide. So we developed solutions through RJ in a myriad of ways. And again, I'm just going to go over some key factors here that I think are directly related to how we use the framework in the context of public policy. First, we developed these solutions by recognizing a woman's ability to determine her own reproductive destiny. We recognize that reproductive freedom is linked to the conditions within a birthing person's community, and we center women and birthing people of color and their unique experiences. And last but not least, we recognize that health outcomes and access to healthcare are central factors that cannot be isolated from social issues such as economic opportunity, exposure to violence, and safe, affordable housing. Next slide. So I thought it was cool to add a fun fact here about the number of maternal health bills that have been introduced, really comparing the last congressional session to this congressional session. So last congressional session ran from January 3rd, 2019 to January 3rd of 2021, and there were 31 maternal health bills introduced. Fast forward to this congressional session, which has only been in place since January 3rd of this year, there have already been 26 maternal health bills introduced. And both of these, can go back to the, thank you, right there. And both of these tallies do include the 12 bills that are part of the Black Maternal Health Omnibus package. And I'm going to talk a little bit more about that. So this presentation, as I mentioned earlier, is really going to focus on key bills and administration efforts, most of which center the Black maternal health issue in a broader, I think, response to maternal health nationally. Next slide. So the Black Maternal Health Omnibus Act has been led by Representative Lauren Underwood of Illinois, Alma Adams of North Carolina, and Senator Cory Booker of New Jersey. It's a comprehensive package of 12 bills that address almost every dimension of Black maternal health, including investing in community-based organizations, the social determinants of health, maternal vaccinations, the climate impacts of pregnancy and childbirth, ensuring compassionate care for veterans and incarcerated birthing people, maternal mental health, and a host of other issues. Next slide. The Maternal Care Act is legislation that is led by Representative Alma Adams of North Carolina and Senator Kirsten Gillibrand of New York. I should mention here that this was then Senator Kamala Harris's flagship piece of legislation when she was a senator. And now we're seeing her champion some of the concepts in this bill, even as vice president, which I'll talk about a little bit later. This legislation focuses on ensuring increased investment in implicit bias training and testing innovations in integrated healthcare services for pregnant people through pregnancy medical homes. Next slide. So extending postpartum Medicaid coverage has also been, I think, a key solution that maternal health advocates have been focused on, particularly in the past couple of years. The American Rescue Plan Act, which was signed by President Biden a few months ago, did include a provision that would allow states or give states the option to extend postpartum Medicaid coverage to at least 1 year without a federal matching increase for a time limit of 5 years. I think the best way to sort of put this piece of legislation into context is to recognize that the American Rescue Plan is a response bill to the COVID-19 pandemic. And so a lot of the provisions included in that bill are not permanent. And so that means the work is far from over in terms of ensuring that this provision and this continuation of postpartum coverage is permanent across the United States and all states for all women. Other key legislation that aims to address this issue are the Healthy Mommies Act, as well as the Mamas Act and the Helping Moms Act. So the Mamas Act and Helping Moms have not yet been reintroduced in this congressional session. Healthy Mommies Act has been reintroduced, and that bill is led by Senator Cory Booker and Representative Ayanna Pressley. The Mamas Act and Helping Moms does have a similar model to what we see in the American Rescue Plan Act, which is that the postpartum coverage extension is an option for states and does not include a FMAP increase, whereas the Healthy Mommies Act would call for mandatory postpartum coverage extension. Next slide. So the COVID-19 Safe Birthing Act is legislation that really focuses on a specific response to the impact of COVID-19 on pregnant women and birthing people. This legislation was led by Representative Ayanna Pressley, and apologies, this is a typo, that should be Massachusetts there in terms of the state that she represents. This legislation ensures that pregnant and birthing people have a doula or support person with them in healthcare settings, as well as a loved one. Early on in the pandemic, we saw a wave of rules that prohibited pregnant and birthing people from having a loved one with them in healthcare settings due to precautions for COVID-19 spread. And so advocates really swooped in to do all that they could, many of them participating in this workshop over the past 2 days to ensure that hospitals would lift those precautions and at least make it possible for birthing people to have at least one person in healthcare settings with them. This legislation also expands access to maternal telehealth services for Medicaid enrollees. It extends the Medicaid postpartum coverage extension to 1 year, as well as for women on the CHIP program, the Children's Health Insurance Program. And it also ensures access to free COVID-19 testing, treatment, and vaccination for all pregnant and birthing people, regardless of insurance status. Next slide. So I also wanted to share some actions by the Biden-Harris administration. You know, this has really been, so far, I think, a banner year when it comes to the response to maternal health that we've seen in just a few short months. First up, we saw that President Biden actually issued the first ever Black Maternal Health Week proclamation in April of this year. We've also seen CMS approve Section 1115 waivers to extend Medicaid postpartum coverage for a handful of states who had pending waivers with the agency. And then we've also seen increased investments in maternal health through the American Families Plan, the president's budget, which was just released a couple of weeks ago, and other vehicles. Again, we're also seeing this focus on implicit bias training. Again, I personally think that's connected to Vice President Harris, the work that she did as part of the Maternal Care Act. And we're also seeing a focus on expanding maternity care among rural populations, as well as addressing racial disparities in maternal health. I also wanted to note here that the last two bullets aren't necessarily specific to maternal health per se, but they are broader healthcare expansions that I wanted to highlight that have implications for maternal health. The first is that under the American Rescue Plan, we saw a whole host of health coverage expansions. I think some of the most wide-reaching expansions that we've seen in healthcare since the Affordable Care Act. And then we also saw President Biden issue a healthcare executive order in the first days of office that focused on a special enrollment period, which will allow folks to sign up for healthcare coverage who have been going without during the pandemic or even before the pandemic. So I think those are some essential pieces to lift up in the context of maternal health. And then lastly, here we also saw President Biden issue an executive order on racial equity that really called for a whole of government approach to addressing racial justice in this country, as well as systemic racism throughout government agencies. And then one last thing I'll add here is that this administration has also been very thoughtful in terms of its political appointments. We saw Chiquita Brooks-LaSore be confirmed and installed as CMS administrator. She is the first Black woman to hold that role. She's also a fierce advocate for maternal health. And you can see that through some of her readings if you want to do some follow-up research after the panel today. Next slide. And so here are just a few recommendations that I wanted to sort of leave folks with, really in the context of the bills and policy efforts that I shared today. The first is that we do need to ensure that postpartum Medicaid coverage for at least 1 year is mandatory, and that includes a generous FMAP increase to states. States are really grappling with budget constraints, particularly coming out of or recovering from COVID-19. And so if we're going to be implementing a mandatory postpartum extension, they will need the funding and support to be able to do that and serve as many women as possible. We also need to move from, I think, asking for passing legislation to actually seeing it reach the president's desk and be implemented. And so the second recommendation here is to implement laws and policies that center the health and social needs of Black women and birthing people. And last but not least, invest in anti-racism training for healthcare providers. I think, bias can be explicit as well. Healthcare providers can be racist. And I think it's time to move beyond the limited conversation of implicit bias training and really be proactive and transformative in how we address these trainings. Next slide. And so here are just a few suggested readings. All of these sort of delve deeper in some of the policy issues I talked through today. The first is really a comprehensive policy blueprint for addressing maternal and infant mortality. And this was published by the Center for American Progress when I was still an employee there. I'll also add to that this first legislation or this first reading material was really the blueprint for what we see in the Black Maternal Health Omnibus. So I would really encourage folks to pick that up. And then we also see a couple of other readings there for you all to check out. If you have any questions, feel free to reach out. I'm going to skip on ahead now because it looks like we're at time, and just looking forward to the questions, and thank you all.
Thank you so much, Dr. Taylor. That really did a fantastic job of laying out what the federal policy landscape is, where we've been, where we're headed, and that really sets us up well, I think. So thank you so much.